Shall we start?
Yeah.
Yeah, we'll start. Okay, nice. I started recording also. Okay. Good afternoon, good afternoon. Good afternoon, Dr. Kranti. Good afternoon, everyone who's present here today. We are here to talk about exercise physiology and the approach in homeopathy for exercise physiology. And we have Dr. Atharva Dole here. Atharva, over to you.
Yeah.
Yeah, great.
Uh, so first of all, good afternoon, everyone. Thank you for joining in today. It is a great honor for me to present my topic here today in front of you guys. So I'd like to clear first of all that I'm not a good orator. So please bear with me if I make any mistakes. And today I'd like to present to you the topic which I thought that would surely add into your armory. Hoping that you guys feel the same at the end of the session. Today I just want to share my experiences and the exposure that I've got through so far, and would like to share it with you. First of all, I'd like to pay tribute to Dr. Hahnemann, the master, pay homage to him. It is because of him that we are existing currently as homeopaths, and we are without whom homeopathy wouldn't exist. I'd also like to thank my parents who have already always supported me in my decisions and always guided me throughout. I would also like to thank Dr. Ketki, who is a part of this team, and she has helped me with the presentation and editing the slides. I'll start off with a short story. It's just a short story about me. My parents always inculcated the passion for sports in my childhood and always made sure that sports was a part of my life. So, as every Indian does, I started playing cricket and I played at the state level for for the age group under 14. And after that, naturally, the board examinations come. So, you have to compromise on things. So, I had to compromise on my cricket during that time. But I made sure that sports would be an integral part of my career in the future. I also participated in various tournaments during my college days. I played the I played softball at the national level, and during my third year, I discovered this wonderful course at the University of Sydney, which was Masters in Exercise Physiology. The benefits of this course I felt that time was I had I would get two accreditations. So one would be a sports scientist and one would be an exercise physiologist. Honestly speaking, I didn't know what an exercise physiologist was back then in the third year. I was only fascinated by the term sports scientist and I was very keen on exploring that field much more. I knew a lot of sports medicine exists, many physiotherapists, many sports physiotherapists exist, but I found that this field is something different and I should explore this more. As every story has, there is always one twist. So this twist came in the form of my university here. After talking to my professors, my fellow classmates, I realized that athletes are at this level. Their performance, their overall strengths, weaknesses are at this level. The general population is around this level. And to increase the athlete performance from here to here is not too easy. It's not too difficult. But for the general population to rise from this basic healthy lifestyle and to increase it here is a huge challenge. And as a homeopath, dealing with all the clinical conditions throughout the 5.5 years of a course, I realized that this challenge would mean much more in my career. And that's when I decided that I would like to work with athletes. I would like to work with the clinical population more. So you all must be wondering, and for there is a thing in like everywhere that exercise approach is needed only for the athletic population. It's not that case. Exercises can be used for all kinds of population and effectively. And I feel it is the need of the hour to inculcate exercise and healthy lifestyle in our daily routine. You all must be wondering what an exercise physiologist is actually. So basically, it is an qualified healthcare professional. What they actually do is evaluate the clinical conditions, understand the pathophysiology behind it, all the clinical condition as we have done in the bachelor's degree as well, make assessments, evaluate the person as a whole, and after that, design, deliver, and prescribe effective and safe exercises. I'm stressing upon the word safe because often I see exercises being done in the wrong way, wrong technique, which causes hamper which hampers the injury, which causes the muscle to function dysfunction. And the last thing I would like to stress upon is it is completely evidence based. All the exercise prescriptions are completely based on the evidence that the researchers have produced. So this is just a basic circle around which the exercise programs would float around. So acute medical conditions would be kind of example like an acute back pain, maybe an acute flare up of old injuries, musculoskeletal stuff. The subacute medical conditions could be asthma, COPD, so exercise intervention in those conditions. As homeopaths, we are often marked as specialists for chronic conditions. We certainly have a role in acute conditions as well, and a quite effective role. Even as exercise physiologists, we are often marked as involved only in chronic medical conditions, no acute conditions. The chronic medical conditions that I have seen so far here at my university clinic or practice, they have a number of mild cognitive impairment patients. They have cancer rehabilitation patients. And it is extraordinary to see the results that exercise give these individuals. I recently saw in a clinic where there were many cases of mild cognitive impairment. They had slow understanding. There is a MOCA score, which is an assessment used to done to calculate the cognitive process of a human being. So these individuals were almost aging 80 and they were having a quite low MOCA score, so they weren't quite cognitive enough. At the same time, as everyone of us will have, and every many individuals I've seen here, the degenerative diseases like osteoarthritis and osteoporosis. But I've seen patients here do resistance training, squat at around 60 to 70 kilos of weight, and while coming in the gym, they are struggling to walk, but while going out, they are walking perfectly. And this is a miracle. You obviously know that there are sports injuries that we can deal with, the ACL rehab, and any kind of post injury rehab. I feel exercise is a very important part in disabilities as well. So, disabilities caused majorly after stroke, traumatic brain injury, and motor vehicle accidents. We all know the benefits of exercise. These are some of those. We all know, but we hesitate to participate in that. I feel the lack is in the consistency. So I feel that it is very important to stay active all the time. It not only reduces our risk of heart disease, which is very important because the numbers are increasing so much. It can improve the breathing. So, as a sports scientist, I was also trained to improve the VO2 max, that is the maximum oxygen carrying capacity of our lungs, to improve. This is very important in elite athletes who require a lot of endurance to work through and maintain that performance throughout the game. It reduces the risk of diabetes, obesity, and mind you, all these are risk factors to cardiovascular disease and, in the end, mortality. It improves the functionality of joints in cases like osteoarthritis, osteoporosis, mainly helping in the individual's function at the functional level. It can reduce the pain intensity. May it be low back pain, musculoskeletal injuries. Among this circle, I feel the square in the center of the circle is the most important one. It improves the overall quality of life. I feel that nowadays the quality of life has decreased so much because there is no healthy lifestyle and lack of exercise. But I would really like to stress upon improving the quality of life. So, people, even here, I'm mistaken as a physio. When I tell somebody I'm an exercise physiologist, so everyone says that, oh, you must be a physio. I'd just like to differentiate a bit between them. So, what I mean by active treatment in an exercise physiologist is that the patient is actively participating in the therapy. In the physiotherapy, it is pretty much a passive treatment. It involves a lot of manual therapy. It definitely involves exercise, and they can definitely prescribe exercise as well. But exercise physiology is a very specific specialization in terms of only exercise prescription. Naturally, exercise is the main mode of treatment that is used. Exercise physiologists can help in chronic recurrent injuries as well as chronic diseases, chronic medical conditions. Physios has a primary role on the field or maybe acute pain injuries and post-operative recovery phases. Improves the general health, stamina, and quality of life. I am going to mention quality of life quite a few times in this presentation today because I really feel that it is very important for us to get our quality of life. In physiotherapy, there is treatment with joint manipulations, massages, and exercise. The last point that I've added in exercise physiology is the behavioral change and self management concepts. This mainly includes the education part of the patient, the overall healthy lifestyle inculcation. As a homeopath, we always try to educate the patient, we always try to counsel, we play so many roles during our practice. Daily, we indulge in the patient's story, making them our own. And I feel that building the rapport is very important in helping the patient to change his lifestyle. So, if some of the students are listening to this, they will naturally feel a question, where can I pursue this course? So, currently in Australia, there are many universities that are offering this course, the Masters in Exercise Physiology. There is a bachelor's course in this as well, bachelor's in Exercise and Sports Science. This is all accredited by the Exercise and Sports Science Australia, that is ESA. In Mumbai, Dr. D.Y. Patil Medical College offers this bachelor's course in exercise and sports science. And recently I came across their syllabus and faculty and I was very impressed. I would highly recommend that course if you know somebody who would like to do that. There are numerous colleges in the UK and the USA who offer this course. Primarily in the US, the American College of Sports Medicine is doing a wonderful job. They are the leading researchers in the world, and many of the exercise practitioners follow their guidelines throughout. What is the use of doing this course? So I feel that you can practice in all health sectors, be it private practice, be it hospital setting, be it workers' compensation, workers' rehab, and a lot of different faculties. It is definitely accredited by the ESA, which is a very renowned body in Australia. Most importantly, for us as homeopaths, you can practice this along with homeopathy. And being a homeopath, we have that clinical knowledge and understanding of the clinical condition much more than those who have done bachelor's in this course. You would also feel the question, why is this necessary? There are so many gyms around, there are so many personal trainers around, and why is exercise necessary and why should we do this? So I'll just like to tell you three researches or the current scenario in the world. And I was quite shocked by these numbers. So a research made by Garrison suggested that people having a BMI over 30, usually over 30 is considered as obese. 25 to 30 is considered as overweight, and below 25 is quite good. So he suggested that people having a BMI over 30 results in decreasing in the life expectancy for almost 6 to 7 years, which is quite a huge number. And most of these cases are due to the cardiovascular disease and which results into mortality. I feel this is a very huge number. The 6 to 7 years is not a short time. According to Gordon et al., the risk of cardiovascular diseases increase with total cholesterol after every 0.025 millimole per liter. So every small change in the cholesterol levels increases the risk for cardiovascular disease. It is quite staggering. A systematic review made by Ahirvar R and Mondal P have revealed the numbers in India as well as overseas. They believe that globally 1.9 billion adults are overweight, 650 million are obese. In India alone, 135 million are suffering from obesity. And these are the primary factors, risk factors for cardiovascular disease. Huh. Recently, I came across this sedentary lifestyle. The clinicians here are calling this as the setting disease. And I found this research so interesting. The research made by Begg et al. In 2007. Mind you, this was 13 years ago. And that time they considered sedentary lifestyle as the fourth leading cause of death due to non-communicable disease. After heart disease, after cancer, and after diabetes. So you can imagine the number if sedentary lifestyle, just sitting around doing nothing, doing no leisure activities, not involving in any physical activity, is one of the is the leading cause of death. And the main cause of sedentary lifestyle results into 21 to 25% of breast and colon cancer, 27% of diabetes, and 30% ischemic heart disease. And this is staggering. This research is staggering in the terms of you cannot imagine that we sitting down in one place for a long period would be harmful for us. The British Journal of Sports Medicine in 2010 suggested that people who sit for a long period of time have an increased risk of heart disease. But here comes the twist again. A research in Queensland University in 2010 suggested that even if the adult meets the physical activity guidelines that are recommended by various researchers, still sitting for long periods of time can compromise metabolic health. So, us as homeopaths, what can we suggest to people? What can we suggest to our patients? What we here do normally is ask to just a simple advice: sit less, move more. That's it. So even if you're watching TV for a couple of hours, make it a point to get up after every half an hour. Maybe just have a walk around, just do a few sit to stands, maybe just do a flight of stairs. Grab water from the kitchen. But get up, move, and come back and sit. Maybe keep the remote away from you so you can change the channel. So these are few strategies that we use. But it is quite important to break this sedentary life. And I'm scared that even if we achieve the physical activity guidelines, still it can compromise the metabolic health if you are sitting down for a long time. I'll talk about this in brief. This is just a journey of an accredited exercise physiologist. So first of all, you should note it that it's a university qualified specialist. It's a 2 years degree and a 3.5 years bachelor's degree. So it's a completely university qualified specialization, which gives a clinician the skill to prescribe exercises for improvement. Definite in-depth knowledge about the chronic diseases, improving quality of life. Here we go again. Also the skill to sorry, we got that again. Improve day-to-day activities. Right now, at our age, or maybe up to 50, we don't consider day-to-day activities as a task or as a difficulty. But you have to realize that our age will progress. We will get old. And once the degeneration starts kicking in and starts hampering our movement, it is going to be tough to do day-to-day activities. Even moving around the house would be difficult at some point of time. And that's why it's very important to educate the patients right now to improve their physical activity, increase the physical activity levels in a safe way. The safety is a very major concern because I have seen older adults getting injured after having falls, and which is terrible to happen. And exercise physiologists are differentiated from all other allied health professionals because of all these factors. They not only have an in-depth knowledge about chronic cases, they can work with athletes. They can prescribe exercises in a safe manner. They can work in hospital setting. They can work in cardiovascular conditions, which is tremendous. It has a tremendous scope, and you can do as much as you can. So these are some of the physical activity guidelines that are being given by the leading researchers. The first line I want you to advise everyone, all our patients, all our family members, friends, that something is better than nothing. Even if you achieve some kind of physical activity, some kind of exercise, may it be running, may it be walking, may it be just stair climbing and stuff like that, but that is going to be better any than doing nothing. So any kind of physical activity is better, but at the same time, you should consider the patient's goals, what they want to achieve through the program, and what are they exactly looking for. The American College of Sports Medicine, of whose guidelines we follow, suggests that it is necessary to do 150 to 300 minutes of moderate intensity exercise. So you'll ask me, what is moderate intensity exactly? So in terms of our language, we term it as about 70 to 80% of our heart rate max. Or if you consider the RPE scale, that is the rate of perceived exertion scale, which you can find many such scales online. On these scales, it is termed as about 13 to 14 out of 20. If you don't have the time to do 150 to 300 minutes of moderate intensity activities, then you can always go for 75 to 150 minimum vigorous activity. And what does that include? That includes about getting your heart rate up to 80 to 90 of your heart rate max. But also, I would like to suggest that you have to ensure that this exercise is done in a safe manner with the correct technique, preferably under supervision if it is a chronic case. There is often a misconception around exercise that aerobic exercise is enough for you. If you do aerobic exercise, if you do running, if you do walking, it is enough for you. Researchers have suggested that muscle strengthening is a must for at least 2 days per week. Why muscle strengthening is needed? When we get older, when we degenerate, our condition will degenerate and the bones will degenerate. The only things that are going to hold us together is the muscles. If they are going to be strong, then we can survive the day-to-day activities. These are some of the benefits of physical activity, and you all know these benefits. Definitely, it is going to help you in some form of the other in all cases of diabetes, blood pressure, cholesterol level, blood sugar levels. Another misconception that we have is that exercise is only done for weight gain or weight loss. We have to ensure that the weight loss is one of the criteria, but it's not always about the weight. There are things that are beyond weight. It is about us feeling better as individuals, leading a healthy lifestyle, and ensuring that we have a good future years. So, reducing the risk in the rehab of some cancers, reducing the risk of cardiovascular disease, I've already mentioned that. One of the points that I feel very important is the opportunity for socializing and meeting new people. During this pandemic, it's difficult. I know it's very difficult to do that. But I feel that during this uncertain times and during so many mental illnesses, depression, cases like depression, the social aspect should be maintained. It is very necessary to have that emotional connect with some person and just have a chat. And this can be achieved through exercise. You can do a group session, you can just walk with somebody, you can run with somebody. Always remember that something is better than nothing. The next point is to prevent the mental health problems. So it boosts our energy levels and helps us in feeling a lot better. Obviously, the development of the mental and maintaining the physical and mental well-being of an individual. So, scope of exercise physiology. One of my professors here at the university, who is a very well-known and a leading researcher in this field, has come up with a hashtag. So that hashtag is exercise is medicine. We should use exercise as a prescription form or as a medicine. It can be termed as the best and the healthiest form of therapy. And it is one of the best form of medicines one can ever have. It's very difficult. I know it's for people it's very easy to take the pills and feel better. But once you do the difficult way, things would be a lot easier afterwards. I feel that it is the need of hour to introduce this concept in India definitely and all over the world. But I would also recommend using use of homeopathic medicines in a combination with these exercises, which would produce much more effects, and you would definitely feel it after you have experienced it yourself. We often have heard that, like, I have often experienced that exercise is a very vague concept everywhere. And I sometimes feel that there are people who are responsible for this, for spreading this vague information. I don't blame the personal trainers for this. They have their part of knowledge. I don't question their knowledge at all. But at the same time, I highly recommend them to use evidence based practices. Use what evidence suggests, because these researchers strive a lot to give us the guidelines, to give us the exact amount or what is the best form of therapy. And this should be definitely inculcated in our day to day practice. I feel that weight loss is not the ultimate goal. Weight loss or fat loss isn't the ultimate goal. The overall increase in our day to day activities, the overall functionality, the overall mobility, independently activeness, quality of life, and better functioning as a human being, as a person as a whole, as we homeopaths term it, is much more necessary. So, what does evidence suggest? There are innumerable researchers going around exercise currently. As I mentioned before, ACSM, the American College of Sports Medicine, is the leading researcher currently, and their guidelines are followed by pretty much all the practitioners, all the clinicians around the world. They suggest that a minimum of 150 minutes of physical activity should be conducted every week. So, as homeopaths, we can definitely advise our patients to do this. Patients ask us what exactly what exactly the exercise we should do, how the exercise should be done. And in terms of a simple advice, we can definitely recommend them to achieve the 150-minute mark. We can, I can confidently say that 150 minute of physical activity would enhance their overall functionality and mobility. This activity can be any kind of activity. As I said before, that any activity is better than none. Running, swimming, walking, anything that they love, playing any kind of sport. indulging in any activity. But at the same time, it is important for us to understand the goals of the patient, to prescribe the right form of exercise. And I'm just wondering if you guys are having this question in your mind. If exercise alone can cause so many benefits, if in the combination of homeopathy or any other different pathy, what wonders will it create? That's where I come to my next point. I always feel that this point is very important and this should be an integral part of all the practices and holistic approach. A holistic approach surrounding the patient is necessary. I feel it is the most important thing currently. And I'd surely like to work in an environment where, or create my own setup where a holistic approach is there. It is very important for us as clinicians to realize that there is no single therapy that can be the most effective in a patient. We should understand the need, the goals, what the patient wants to achieve, and how we can offer him the best results. It is crucial to work together. And at the same time, we have to understand that each and every practitioner has an advantage and a disadvantage of his own. I realized this last month when we at the university had a health collaboration committee meeting wherein a few therapies got together and had to crack down a case. And I felt that it turned out to be such an easy event because each one knows their role and knows best how they can help the patient in getting the cure and getting relief. As homeopaths, we are always told to consider the person as a whole, to consider an individual. And considering this, the overall treatment, the overall holistic approach is necessary to treat the person completely. So I now come to the application part of homeopathy where I would share my experiences with it. I did an project during my internship at the Bharati Vidyapeeth Homeopathic Medical College. I collaborated with the Physical Education College of Bharati Vidyapeeth, wherein I did a comparative study. I specifically did that for sports injuries, but I'm sure the application would be in all medical conditions. I did a comparative study with three groups. One included only homeopathic medicine, one included only exercise, and the third one included a combined therapy. And I found that the combined therapy gives the best result. It is so essential to work together. I have seen many setups, many clinics that have already started using homeopathy as an adjunct to the other therapies. I have seen a clinic where they have a physio, they have a psychologist, they have a sports medicine, and they have a homeopath working together and helping the patient to get better. I know it's very difficult to achieve this. It's very easy to say that this setup should be created and this setup should be done, but it's very difficult to achieve. I know that. But you can definitely get some advice from the other clinicians who are expert in those fields. So, I am actually not keen on discussing the drugs that are used for the sports injuries because I feel a patient is an individual of his own, and we, in all these seminars and webinars, each presenter would tell about some specific remedies, but I'm not until we take the history and until we fully process the case. It is not easy to prescribe a remedy based on some others' thinking process and some others' learnings and their experiences. It is important for us to give the remedy according to the individual, according to the goals of the patient and what the patient exactly needs. So, the drugs here I have mentioned, you all must be knowing it. Arnica, Ruta, Calendula. Arnica, as you know, are used for blunt injuries. So, these are quite the common drugs. And I'm just mentioning these for you to just have a quick refresh in your minds. The Ruta is for sprains, for chronic regular sprains. I was quite surprised by the results of Calendula that I've experienced. Alan mentioned Calendula in ligament tear, and I have seen the results. I've worked with the sports medicine and I have seen the healing process enhance when I gave him Calendula. Many orthopedic doctors use symphytum for fractures quite regularly to enhance the healing of fractures and the bones. Ledampal is used for swelling, Beluspurs. They have sprains with great soreness. I'd like to talk about Rustox for a bit. The DOMs that I've mentioned, we term it as delayed onset muscle soreness. Often, individuals who are not exercising regularly, not indulging in any physical activity, often experience delayed onset muscle soreness because their muscles, their body is not used to that. So they get the muscle soreness a little late. And that's exactly where Rustox comes into the picture. I'll talk about exercise physiology and homeopathy now. So, as we all know, the principle of individualization, exercise physiology has similar concepts. Even an EP would consider a patient as an individual. Every individual would be given a different set of exercises, a different exercise prescription, just as a homeopath does. A homeopathic would never repeat his prescription. He would consider the individual as a whole, and maybe his experiences would help him categorizing the remedies, but always the remedy would be different. I feel that the combination of these two factors would be incredible. I'm so excited by the prospect of coming back to India and working in a setup where I get to prescribe both of these together and achieve tremendous success. I'm sure of it that it would hit the target. It works amazingly well in clinical population. The most important thing that we are concerned about is the clinical population. And it can create wonders. It can reap huge benefits if we combine these two together. As I have mentioned before quite a few times, the quality of life, the betterment of quality of life, we know as homeopaths that even after giving homeopathic medicines, we achieve that quality of life. Patients often tell their experiences that they were suffering so much since so many years, and they improved after the homeopathic medicines and without any side effects, without suffering through, without the pain of taking the medications and stuff. They have improved so much. I would like to highlight this point a lot because I understood the importance of evidence based practice after I reached Sydney. I knew about researchers and stuff back in India, but I realized how much importance they give here for the evidence practice. Each statement that I'm passing, I'm writing down, it needs to be backed by evidence, and it is so crucial. But why is it so important? It not only updated knowledge is one of the factor that we are updated ourselves that what is happening around the world, what exactly how researches are conducted, and how are they going to help us. But it also gives us the surety of results because it has been experimented on so many individuals. It gives us the surety, and we can be confident enough to express to our patients that we can get them out of their misery. It also gives us the credibility of working in an evidence-based practice setup. It helps us realize that the leading research that is being done would certainly help the individuals. I would like to finish off with a case. This case has not been prescribed on homeopathy, unfortunately. I would really have loved to give her homeopathic medicines and see how the results would be much more enhanced. But this is a case of an 86-year-old female who had visited the hospital. She had COPD and severe shortness of breath. Her daily activities were reduced. She couldn't do complete her activities, and the part that I feel, she was living alone. Her sons were abroad, and she had to do all the stuff herself. I realize we often think that exercise is only for young individuals. Exercise is not for older adults. Exercise is not beyond 50 years of age. Exercise is just for younger adults. But I have seen patients here working hard at the age of 86 years. They're striving hard to achieve the health, the fitness. And after 6 weeks of exercise intervention with this lady, I was amazed by the results. I was blown away. Honestly speaking, I couldn't believe. I thought that she would improve her day to day activities, but I never believed that the spirometry results would improve. Before exercise, we had conducted a spirometry wherein her vital capacities were moderate. Below moderate, I would say, because she was feeling shortness of breath. We do a 6 minute walk test. Like, it is an assessment, very basic assessment to understand the endurance or the fitness of an individual. It is just walking for 6 minutes. Imagine if somebody asks us to walk for 6 minutes, we would say it's very easy, but for these individuals, it's very difficult. And I noticed during the initial assessment that she was struggling to finish the 6 minutes. And now, at the end of the session, I could see her complete 12 minutes of treadmill walking quite easily. And that was her prescription, but she could manage it easily. The staggering number was the 27% increase in her vital capacity. The obstruction of her lungs, the pathway of airway was so facilitated by the regular muscle activity and boost of the stimulus. She improved her mobility, she became much more independent, improved her day to the most important things, and that was my goal when I did the initial assessment on her. I only wanted to focus on her day-to-day activities. I just wanted her to get back to normal. I didn't care about the spirometry results. I just wanted her to function independently normally because she was living on her own. I couldn't believe for the last day on the assessment day, she drove herself to the hospital. She was struggling to even walk and she drove herself to the hospital. It was amazing to see. I would like to finish off by some take home messages. As the point of exercise physiology, we have to consider exercise as a medicine. The important thing that you can advise to your patients and suggest to your patient, any kind of physical activity is better than nothing. You can do any form of activity and achieve some kind of basic fitness. The most important thing that as we as homeopaths do that as well, enlightening the patients, educating them, motivating them to be much more healthier, be fit, curing them of the disease. As a homeopathic perspective, we can consider a holistic approach, treatment in cases along with exercise physiology in terms of prescription of exercise. Also, homeopathic treatments for clinical conditions, along with this intervention, along with prescribing a few basic exercises, helping them achieve their goals and helping them curing at a much better rate. Thank you for your patient listening. I have expressed my views in what I've learned so far. I will definitely thank the organizers, Karthik sir and Rashmika, for giving me this opportunity to speak here. It has been a great pleasure for me. There are also a few contact details, like there's my email ID. You can definitely contact me anytime. I can advise you if I the best way I can. And the mobile number is also there, but it's only for WhatsApp because this is my Indian number, so it's only for WhatsApp. Thank you.
Thank you so much, Atharva. Thank you so much. It was really nice. It was likely, like Edil said, it was very insightful, especially when you mentioned that evidence-based. Everything has to be evidence-based these days, especially in this day and age where social media is, flying everywhere else.
Yeah,
Evidence based is one strong point for be it exercise physiology or homeopathy. We need one strong point because anyone can post anything on social media being this is just a placebo, this is just a physiotherapy, it's no different. But when we have a strong base point saying yes, I have this evidence, if you want you can use this, that is where we stand strong and say that our pathy is flying high, is where I can
exactly.
say flying high.
Exactly. That is a very
And
good point.
very true. And if anyone has any questions, please ask your questions. We would love to post it and ask Dr. Atharva about it.
Somebody asked me about the dose of calendula.
Yes, yes.
Um,
Karthik has
so
asked.
so I didn't use any ointments or external application. So I just gave calendula 30, and this was post surgery. This isn't. So I'm not saying that I prevented the surgery, and I have no claims of that sort. But this is after the surgery, and this is just enhancing the healing process of the ligaments. Yeah,
Calendula
informative dose.
30.
Yeah, informative dose. Yeah. I actually gave it in repetitions because I believe repetitions. I don't use single dose.
Very useful webinar.
Yeah.
Thank you so much,
Thank you so much for the
Dusty.
messages.
Yeah, and I think you know in between like most of them, especially in this lockdown situation, so many people have picked up a habit of exercising and
Yeah.
you know getting a routine of exercise. But
Yeah.
what message do you have for them when everything, hopefully everything goes back to a normal day-to-day life where everyone can go out and start working back again? What message do you have that how they have to continue and how they can because the effect of suddenly exercising and suddenly losing your exercise,
Yeah.
that is the muscle memory is
Yeah.
so what message do you have for them saying you have to continue with the exercises?
I feel that we even me lack in consistency. Consistency in doing everything. Like there should be it should be a religious process to do every single day, achieving the goals, setting up some goals. Like we can do a few things like there are apps or there are the we can count the number of steps in our phone. So achieving the 10,000 marks daily, just keeping those goals in our mind and ensuring that this is a safe form of exercise, consulting a professional, consulting clinicians like us, if we can do this exercise is very important because I see people putting up videos which are in the wrong technique, wrong form, and I feel very sorry for them because if they suffer from any injury, they'll just blame the professional.
Very
They'll not blame the personal trainer or the video that they have seen on Instagram from which they have followed. They'll blame the professional that the profession
very
has
true.
hampered us.
Very true. Very true. That is the worst thing these days.
Yeah,
Like I said, everything is available everywhere. So
yeah,
anyone can do, and there have been, it's not like it's not, there have been coming at present to the clinic saying they have been doing, one small posture, one
yeah,
small jerk will give immediate sprain to the leg or the hip or
yeah,
anywhere else, and it becomes a huge obstruction to their everyday day-to-day activities.
yeah.
Any other case that you have seen other than COPD in the, with
Um,
exercise?
so I have seen recently I saw a case. Believe me, it was a 97-year-old male, and imagine a 97-year-old male suffering from bilateral hip replacements at that age,
Okay.
and I was so happy by his progress and his motivation to be like healthy, be fit, doing things on his own. Because in India we have a tradition that the family lives together, but
Mm,
overseas the family don't live together; they're alone.
very
He lives alone, and he has to do all of these activities alone, like cooking, like vacuuming, stuff like that. And it is very hard for these people to achieve. And being a 97-year-old person coming to the gym regularly 2 days in a week, doing push-ups, doing squats is
my God,
incredible to see. And this really gives me the inspiration to, like, if they don't have any excuses, why do we have excuses? Like, why are
very true.
we postponing things, procrastinating? Yeah,
Very true. Like, initially when you said sedentary lifestyle,
yeah,
I think if you take a survey, around 40 to at least minimum 40% of 40 percentage would be leading a sedentary lifestyle
yeah,
because everything is out to them. They don't even need to step out these days to get groceries. Everything
yeah,
comes to their house. So
yeah,
sedentary lifestyle is one dangerous thing.
yeah. Like, it's the fourth leading cause of death. So,
I know. Uh, Joe Riley has asked, what is the best remedy for tendonitis from overuse of joint? She's
um,
asked from the Facebook Live of ours.
okay, okay. So I would use Rustox in these conditions. So, like inflammation, tendons involved, and overuse, basic the repetitive movement and repetition of the joint your movement. I'd use Rustox in that case. But still, I would suggest considering the case, considering the totality, and then prescribing the medicine. Also,
Yes, very
Rustox
true.
could have the stiffness that he might be having.
Very true.
Yeah,
There are various medicines, Brinia,
yeah,
Rustox,
yeah,
Belladonna, so many
yeah.
medicines that
That
could
are
act
very
on
reputable. Yeah,
tendonitis. Yeah.
yeah.
Thank you so much, Joe Riley, for asking. There's another question from Kasturi Ranjan. One second, I will just post the.
Yeah, have you handled any cases of rheumatoid
Yeah.
arthritis? Yeah. So I have seen cases of rheumatoid arthritis here at the hospital. But unfortunately, here I am not able to prescribe homeopathic medicines for that. But I'm sure that it would definitely boost up the recovery and get more relief. But for rheumatoid arthritis, there are many exercises that help in muscle building, muscle strengthening, and which
Hmm.
would definitely fasten and help the recovery quickly.
Very true. Is there any other question that anyone wants to ask? I like the concept when you said, you have to combine a holistic approach.
Yeah,
There's always a saying when, two heads is better than one. So
yeah,
two different people, especially when you said no, that they would know if a person who is for a nutrition, a diet and nutrition, would do a better job than a regular clinician in
yeah,
saying these many calories to be consumed. At the same
yeah,
time, of exercise physiologist would definitely give a better recommendation.
yeah. But at the same time, I feel that there is a need for certified clinicians to do
I
that.
was coming. I was coming to the
Um,
same question.
because
Do you? Huh?
yeah, yeah, yeah. You go
do you
ahead.
think do you think that every personal trainer or a gym trainer should do such a course to be qualified as a trainer and then join such places where they can
Definitely,
recommend?
yeah, definitely. I'll recommend that, or at least be aware of all the researches going around, because
Hmm.
I see a lot of people posting on Instagram, Facebook, and posting random stuff. I'm not against
Yes,
them, or I'm not judging their knowledge or stuff,
yes,
but make sure that you have researched enough, you have considered all the things, and then advising people. Because I see people posting weight loss of about 6 kilos in 4 weeks, 8 kilos in 4 weeks. According to the research, according to the guidelines, the only amount of weight loss, healthy weight loss, is 800 grams in a week. So that's the healthy weight loss that you can do in a week. You should not go beyond that. It is not healthy. People don't realize that. It is okay for athletes who are competing at a higher level, elite level, who wants to be ready for that competition. Like
very true.
they have certain weight barriers. It is okay for them. But for general population, for people like us, it is not healthy at all. And I really feel bad when I see such kind of posts. I know it's good. It's a good feeling that you're losing weight and you're losing at a rapid pace, but it's not healthy.
Very true. Like
Yeah,
when you ultimately when you stop doing that, if it's a 4 week course or a 5 6 week course, once you stop doing that, your muscle would get uh, okay. There's another question.
yeah.
Do you think homeopathy will be received better in Australia into the future?
I certainly hope so. I certainly hope so. I am wishing to do like they will do that. The problem I feel is not like, honestly speaking, it is. I feel it is a conspiracy by the pharmaceutical companies that are not allowing homeopathy to be in the government's agenda, government's plan in terms of insurance. And I really feel sad after this domination by the pharmaceutical companies, because I really feel that this is the thing that is happening currently. And I really hope that Australia, like not only Australia, but all over the world, homeopathy would spread, because we know the results, we know the cases, we know the what it causes, and hopefully it will happen soon. Yeah.
Very true. Uh, Fingers crossed. And
Yeah.
I think there are so many individual private organizations in Australia that they're doing amazing work, and they're trying to get trying to collaborate
Yeah.
with other countries as well.
Yeah.
If I think unity is strength again. So if we all unite together, everything will be possible as such.
Yeah.
Very
Yeah.
lovely, very lovely. I think there's another question. One second. Is there any PG courses available?
So there is a PG course available for this in the University of Gwalior, if I'm not mistaken. I would like to research about it a bit, and I'd surely like to tell you about it. Gwalior or Guwahati, I'm not 100% sure, but it's one of those, and they offer a master's course in this.
Is
I'll
there a one in
double.
Mumbai?
No, the Mumbai DY Patil is offering a bachelor's course in this. It's not a master's
Okay,
course. Yeah.
okay, okay, okay. That's amazing, Atharva. That's amazing. I think we are. It's been 5 minutes ahead than our one hour session. So
Yeah, yeah.
I think we'll close the session now. Session here. Yeah.
All right. Thank you for the
Thank.
opportunity. I'll thank Karthik sir and you as well for giving me this opportunity. And it has really been pleasure to converse and speak about the topic because I think that it needs to get introduced everywhere. And thank you. Yeah.
Thank you so much, Atharva. I think we pulled you here because we need everyone to know what exercise physiology is, and as you told, we need to know how different is exercise physiology than physiotherapy. And I think it was a wonderful insight on it. Thank you so much, and hope to see you more, and hope you grow more and make a bigger team, and we'll all join in for another wonderful webinar of the same. Yeah.
Definitely. I would love to have that. And I also thank all the audience members for their patient
Yes.
listening. I am terrible at this, but thank you for bearing with me.
No, you were really nice. You were really smooth. Don't worry. Thank
Okay,
you
thank
so
you.
much, everyone, for joining us today. Thank you so much. Have a pleasant weekend.
All right.
Weekend.
All right. Yeah.